Hi, my name is Kayla Yancho, and I'm in the Family Nurse Practitioner program at Oakland University. My topic was how the ACA addresses the role of maternal and child government programs. So, one of the most important public health goals of the US is to improve the health and well being of women and children. Despite efforts in trying to reduce health disparities amongst women and children, many health disparities still remain. So, for example, children from families receiving welfare are 3 times more likely to stay on welfare in adulthood. The CDC Inequalities Report from 2013 has identified the preterm birth rate for Black infants was 59% higher than white infants and 49% higher than Hispanic infants. And in a study by Batra and Associates, it was found that rates of low birth weight births among Blacks are twice as high of whites, and social policies to address poverty may be effective in balancing health disparities between racial groups. So, because of this, it is imperative that this population receives representation under legislature such as the Affordable Care Act, and that there are government programs in place to provide healthcare and resources to vulnerable groups. So, the purpose of my project was to identify how the Affordable Care Act addresses vulnerable populations, such as women and children, and explore the role of the maternal, infant, and early childhood home visiting program that was a provision that was set forth by the ACA. So, for some background information on maternal and child health, the Kaiser Family Foundation defines maternal health as the health of mothers during pregnancy, childbirth, and in the postpartum period. And child health is defined as the health of children from birth through adolescence with a focus on early childhood before the age of 5. Maternal and child programs are set in place to reduce health disparities amongst this population and focus on topics such as low risk deliveries, safe sleep, breastfeeding, immunizations, and oral health, and so on. As a provision to address children and families of at risk communities, the Affordable Care Act Maternal, Infant, and Early Childhood Home Visiting Program was introduced. So, this is called the MIECHV program for short. This program allowed for the collaboration of federal, state, and community levels to improve the health and development of children and families through home visiting programs. It uses funds through the Health Resources and Services Administration and the Administration for Children and Families to better manage services within at-risk communities and to improve outcomes for families within them. Before the implementation of this program, prior research on home visiting programs has shown improvements in maternal, prenatal, infant, and child health outcomes and readiness for school, increased socioeconomic status, and more referrals to support services in the community. So, the eventual goal was for policymakers and practitioners to come together on the best approaches in implementing these home visiting programs and to improve upon the already established evidence based practice. So, as of September of 2021, $342 million was funded to 56 states, territories, and nonprofit organizations in support of communities providing visiting services. Since the MIECHV program was implemented, there have been many proven benefits that have come out of it. So, according to the HRSA website, there have been benchmarks that have been made in improved health outcomes for mothers and infants, increased readiness for school, improved economic stability, reduced child abuse and domestic violence, better management of community services, higher rates of depression and intimate partner violence screening, and better outcomes in safe sleep. Other research has also shown that home visits during pregnancy and early on in life can improve health outcomes for both the child and family that carry on through adolescence and into adulthood. And then to further explore the advantages and disadvantages of this program, I analyzed 2 studies about home visiting programs. So the first study was by Turner and Associates, and it found that despite federal support in expanding home visiting programs, there were still high unmet needs of the population. So there were still like great health disparities in like these at-risk populations, and not enough of these people were taking part in the home visiting programs. So this was greatly due to these programs being voluntary and participant involvement is not guaranteed. So the purpose of this study was to study the intentions of pregnant women and new mothers to participate in home visiting services. So 21 participants were interviewed with questions based on their first impression of home visiting services, their advantages or their perceived advantages, disadvantages, and self-efficacy in participating in a home visiting program. So the main perceived advantages were overall health and safety of women and their children, convenience of having somebody come to their house, education on infant care and breastfeeding, and having more social support. The main perceived disadvantages were losing autonomy as parents or fear that their parenting styles were being judged, the inconvenience to their schedule and daily lives, discomfort of having a stranger in their home, and then the length of the program in general. And then it was found that work was their main barrier to participating due to schedule conflicts. Overall, this study showed that marketing should highlight the program's content and purpose, and providers should be flexible and willing to work around participants' schedules. The second study I highlighted showed another advantage to home visiting programs, and this study was done by Vanderberg and Associates, and the purpose was to implement an abuse screening program or an abuse screening protocol within a group of women receiving home visiting services. So overall, this study showed that public health nurses have an important role in screening and identifying women who are abused, and it also highlighted the importance of abuse training for nurses. So after researching this whole topic, I think the adoption of the MIE CHV program was a great provision by the Affordable Care Act. So I'm a NICU nurse, and I see firsthand the amount of health disparities there are in the NICU, and there are so many women who have minimal prenatal care or young mothers who aren't really sure on how to care for an infant that would benefit and be open into participating in a program like this. The MIE CHV program would not only improve outcomes for the mother and baby, but it would also help connect these families with valuable community resources as well. On the other hand, I think the biggest fault to these programs is the lack of education surrounding it. So because they are voluntary programs, many people might not know about them or might not see how much they could benefit them in their lives. And then based off of the first study that I analyzed, many of the disadvantages of this program could be resolved with better education and marketing to participants. So this is useful to me as a family nurse practitioner, and especially being interested in women and children's health, that this information could be useful in educating and promoting government programs like this to potential clients. I also feel like the MIE CHV program could provide many opportunities for APRNs as well. So as primary care providers, APRNs are in a good position to facilitate programs like this and other government programs as well. Aside from this, APRNs could also help with the development of home visiting programs. So as I said before, the hope is eventually for providers and policymakers to come together and improve upon the evidence-based practice surrounding these programs. And with our specific knowledge base and expertise, we are in a unique position to foster and build upon the evidence-based practice, and help develop home visiting programs. So in conclusion, I think the MIE CHV program is a great provision to address the healthcare needs of mothers, infants, and children. There are many proven benefits to the program, such as greater developmental outcomes, reduced child abuse and domestic violence, and improved maternal and child health and safety overall. Despite this, there are still many flaws and areas to improve upon, such as marketing these programs in practicality. And then APRNs are not only in a great position to be facilitators for programs, but to also apply their knowledge and expertise to make policy changes and improve upon the evidence-based practice as well.